If you want to cut me off, you can.
I'm cutting you off right now.
But you cannot muzzle
I'm cutting you off right now.
ranking member
I'm cutting you
under
off right
these
now.
rules.
I'm cutting you off right now.
You are stopping an opening statement just because you don't want to hear the facts. I think that's really regrettable.
You can continue your opening statement.
Fortunately, my Republican colleagues, I think, are willing to listen.
You can continue your opening statement, but let me make a
So let me just conclude by saying
or you are going to conclude.
Right now,
that's good to hear. I want to welcome and thank everybody for attending today's hearing titled Assessing the Damage Done by Obamacare. I want to especially thank the witnesses for the time and effort you put into coming here. I know we've got one of the witnesses took a red eye in. We ought to run a poll on the audience, see if you can identify who that person was. I'm not going to blow it. But again, thank you so much for your time and effort. Even before Obamacare was implemented, President Obama's repeated promise that if you like your doctor and health plan, you could keep them, was labeled PolitiFact's 2013 Lie of the Year. In a recent column, the Washington Post stated, quote, "The real problem is that the Affordable Care Act was never actually affordable." Today's witnesses will provide the gory details of exactly how unaffordable and damaging the signature legislation of President Obama and the Democrat Party has been. I've asked our three majority witnesses to each address a specific area where the damage has occurred. Our first witness, Joel White, will describe how further expansion of the third-party payer system under Obamacare has led to greater consolidation within all sectors of the healthcare industry, dramatically reducing competition and driving up costs. Our second witness, Taryn Bragdon, will describe the damage done to Medicaid and those who Medicaid was originally designed to help. Our third witness, Brian Blaze, will detail how the insurance market for individuals was dismantled and replaced by the Rube Goldberg Obamacare marketplace exchanges that, contrary to President Obama's promise of lowering family premiums by $2,500 a year, have caused premiums and deductibles to skyrocket. The witness for the minority, Shannon Verstegen, is a fellow Wisconsinite who I have a great deal of sympathy for. She is a victim of Obamacare's skyrocketing premiums and the limitations on small employers joining association plans, thereby forcing their employees onto the unaffordable exchanges. In Wisconsin, Obamacare exchange plans have increased 3.3 times the rate of inflation since 2013, whereas employer-sponsored insurance has risen at 1.6 times the rate. As a result, Ms. Verstegen's premium is more than $5,000 higher because of Obamacare. And if you compare it against inflation rate, that's about $7,500 higher than it probably should have been had we actually controlled costs with a health care plan. Today's hearing will highlight Obamacare's failure to meet its objectives. In March 2010, CBO score used to pass Obamacare, it projected it would reduce deficits by $143 billion over 10 years and reduce the number of uninsured by 32 million by 2019. In 2013, the year before Obamacare implementation, 55 million Americans were enrolled in Medicaid. By 2019, that figure had increased by 17 million to 72 million, with Medicaid expansion accounting for 19 million of that total. That means enrollment in traditional Medicaid actually decreased by 2 million individuals over that time period. I know it's a lot of numbers. There's more to come. There were 12 million people enrolled in the individual market in 2013 and 14 million enrolled in Obamacare marketplace exchanges in 2019 for a net gain of 2 million. So you add that 2 million to the 17 million added to Medicaid, and the net reduction of uninsured due to the implementation of Obamacare was 19 million by 2019, only 59% of the 32 million originally projected by CBO. So first lesson there is kind of ignore CBO scores. They're not that accurate. Comparing 2025 to 2013, there are now 22 million more people enrolled in Medicaid and 12 million more enrolled on the individual exchanges, indicating a 34 million increase in enrollment. But wait, what is unknown, however, is how many illegal immigrants are included in the enrollment figures and how many phantom policies have been written for people who don't know they were enrolled and as a result make no claims.
It is a Republican effort to destroy the Affordable Care Act. We are seeking to extend the health care tax credits past the end of the year. They make health care insurance affordable for millions of Americans who are right now going to the exchanges and trying to determine whether they can afford insurance. A commitment, an agreement, a guarantee that those tax credits will be extended will enable reopening the government. But that issue is not what brings us here today. It is a broader, relentless, calculated campaign to repeal the law that underlies those tax credits, to destroy the ACA and take away health care insurance from millions and millions of Americans who have come to rely on it. 15 years ago, Congress passed the Affordable Care Act, literally life-saving legislation that made health care accessible for millions of Americans and guaranteed coverage for millions more who suffered from the so-called pre-existing conditions that insurance companies use as a pretext to deny coverage. It made insurance available for millions of small business people, farmers, and others who were self-employed. It made health care accessible to children who otherwise would break bones or get sick and have no accessible health care. And it lowered the costs of insurance for millions. Ever since then, Republicans have been trying to destroy it. They sought to destroy it through more than 60 votes within a few years of its passage, and failed every time, but they came close. I am haunted by a moment, one of the most moving and momentous moments in my time in the United States Senate, when a single vote prevented the repeal of the Affordable Care Act. It was John McCain's vote when he famously went to the well of the United States Senate as the last one of us to vote, and he gave that famous thumbs down with his still handicapped arm. That moment lives with us. And it showed the courage and strength of that great hero, a bipartisan hero. And the Affordable Care Act ought to have bipartisan support because the people who benefit from it don't get sick according to their partisan affiliation. People who are Republicans, Democrats, red states, blue states, we all need health care, and we all need health care insurance. Now, in the years since that moment, that famous moment when John McCain preserved the Affordable Care Act, it has soared in popularity. It turns out that Americans really like having access to affordable health care, and the ACA is more popular than ever. This hearing is part of an increasingly isolated and aberrant movement within the Republican Party itself to continue the effort to repeal affordable health care. The American people said loud and clear on Tuesday that affordability is front and center on their minds. The affordability of rent and food and electricity and, yes, health care and health care coverage. Millions of Americans have no other option than the ACA, and they can obtain coverage only through the ACA. One of them is Sarah Colon. She lives in Clearwater, Florida, and I want to tell you a little bit about her story. We're going to play a video.
My name is Sarah Colon. I live in Clearwater, Florida with my husband. We have a blended family of 6 kids. Our oldest is 24 and expecting a baby this month. The other 5 children live with us. Jordan, our second oldest, has muscular dystrophy and is permanently physically disabled in a wheelchair. Our other two college-age kids are in college, and our youngest are 9 and 11, and these four are all on our health insurance. We have health insurance through the healthcare marketplace. We got it a couple of years ago when my husband was no longer eligible for health insurance through his employer due to needing to take a little bit of extra time to take care of Jordan, who's in a wheelchair and needs extra help. The marketplace was really the only option for us. For middle-class Americans who don't have private health insurance through their employer and don't qualify for Medicare or Medicaid, there isn't another option. So we did apply through the marketplace and we got health insurance. It's not cheap. The only thing that makes it even remotely possible is the tax credits that we get that help defray some of the cost of the insurance. We found out this month that our health insurance costs are going to skyrocket to about $3,700 a month without these tax credits, and that's just completely impossible for our family to afford. Our house flooded last year during Hurricane Helene. We had to evacuate Jordan in a canoe. We just got back in our house in March, and we've just got through a tremendous amount of renovations, a huge expense, and we're not really in a position where we can move because our house is set up for Jordan. We have a handicap accessible bathroom, we have widened doorways, his wheelchair can get around, and it wouldn't be able to in another place. Between home insurance and flood insurance and healthcare, we would be looking at paying about half of our income just toward insurance. And this is completely unrealistic for a middle-class American family. My husband and I are hard workers. My husband voted for President Trump. We just want to have affordable healthcare for our family. It's really scary to think about dropping healthcare when you have two young kids. The little things that happen, they get broken bones, sprains, things like that. And my husband and I want to have access to routine healthcare to make sure that we don't miss any healthcare issues as we get older in our 40s and 50s.
If you want to cut me off, you can.
I'm cutting you off right now.
But you cannot muzzle
I'm cutting you off right now.
a ranking member
I'm cutting you
under
off right
these
now.
rules.
I'm cutting you off right now.
You are stopping an opening statement just because you don't want to hear the facts. I think that's really regrettable.
You can continue your opening statement.
Fortunately, my Republican colleagues, I think, are willing to listen.
You can continue your opening statement, but let me make a
So let me just conclude by saying
or you are going to
that
conclude.
right now,
That's good to hear.
Millions of Americans are wondering what is happening in Washington, D.C. And watching this hearing where the chairman is trying to muzzle a ranking member who's simply calling attention to the facts surrounding the ACA and the real-life stories of people like Sarah and Shayna Verstegen from Wisconsin indicates to me that we need to shine a light on what this effort is to repeal the ACA, and we need to stand strong in favor of affordable health insurance in the United States. Thank you to all of the people who have come forward, contacted me, who are here today to bear witness and be advocates in favor of affordable health care for people in the United States. I have more that I am going to say, but just let's be clear. Assessing the damage done by Obamacare, the name of this hearing, gives away the game plan. Republicans are refusing to extend enhanced tax credits because they hate the ACA more than they care about the pain that this move will inflict on families.